Do you know that robotic surgeries is expanding as a minimal invasive approach in the management of complex GI cancers in last 1 decade? I am Dr. Manish Jain. I am GI cancer surgeon specialist at Max Hospital Saket. I am going to talk about the role of robot in the management of complex GI cancers today. Whenever a patient is diagnosed with a GI cancer, there are always two key questions which comes in front of a surgeon. One is always, what is going to be the extent of surgery? How much portion of intestine are you going to remove? And second key question is always, what is going to be your approach, whether it is a classical open approach or a minimal invasive approach. As we know, traditionally all complex GI cancers are managed by either open approach or sometimes even laparoscopic approach. However, the introduction of robotic surgeries in last 1 decade has given us a definite advantage over these two approaches. How robotic surgery is better than a laparoscopic surgery or a classical open surgery is that in a robotic surgery, surgeons manage to operate while sitting on a surgeon's console, which is few meters away from the patient's cart in the same operation theater, and through that surgeon's console he controls all the robotic instruments as well as the camera system which he introduces into patient's body through minute incision. Through his pincer movement, he controls the movement of these instruments, and whatever he is doing at surgeon's console is translated into the movements, finer movements of these surgical instruments inside the body, and he is able to remove the tumor without damaging or harming the other vital organs in the near vicinity. The another advantage of robotic system is its advanced 3D magnified camera system along with ICG. So this camera system is very advanced in a way that it helps us to see very small minute nerves in confined spaces of abdomen. Particularly if I give you an example of pelvis, which is a bony confined space deep in the body where all many vital organs are lying, particularly rectal cancer patients, where the challenge is always to preserve minute nerves as well as blood vessels which are supplying to important urinary organs as well as sexual organs. So these vessels or nerves are better visualized by robotic surgeries, and we are able to remove rectal cancer along with its lymph node without harming these nerves, giving us a definite advantage over conventional laparoscopic or open technique.